Hey everybody, Dr. Steve here. Welcome to The Connected Life. Today we are going to be speaking about how to let go of pain. I'm going to show you this really cool rubber band exercise that I've done tons of times with my patients. So look forward to delivering this to you. All right, now most of us have experienced some form of pain in our life. And I'm not talking about, just big emotional pain or mental pain. What I'm really talking about is things that got anchored into the body as physical pain. Like it could be a strain, it could be a headache, it could be some sort of like spinal pain, low back pain, wrist pain. It doesn't really matter, but something that seems like it's kind of encased in the body. I want to describe to you a little bit about what happens with this and why we do this particular exercise that really expands the mind. And I want to show and share with you why this actually seems to work. So I want you to picture this being maybe you or someone you know and love. And these little red X's are maybe some form of pain somewhere on your or their body. So now, the reason that we present this exercise to you is that when we experience something in our body, our mind has a bit of a safety valve to it. And as soon as we have pain that's elicited in our body, our mind gets very condensed and very kind of precise on the area that's in pain. And its role is to assess it, to make sure that you're not in danger, to make sure your life isn't in jeopardy, so that you can kind of continue on with life. But oftentimes, when the mind has judged the pain, it kind of has this relationship with it that's rather disconnected. And most oftentimes, as your mind is watching the pain in some form of your body, it wants it to go away. And if it doesn't go away in a certain period of time, it starts to get a little panicky, a little anxious, and it wants it gone as soon as possible. And welcome to the whole healthcare industry at the beginning, which is about trying to get rid of a symptom or of a pain. But if you've noticed that something kind of lingers around, it's a little bit more chronic, it doesn't seem to be going anywhere, then we need to manage that a little bit differently. And I want to share with you a kind of like a holistic tool that I was taught years and years ago by some mentors of mine that I want to pass on to you, that I've used countless of times in my practice when people have come in with different pain patterns and such. So the idea is we're going to take this kind of rigid mind and we are going to expand it. And we're going to expand the view. So think of like when you're on the ground level at a hotel and you're there and it's noisy and taxis are driving by and cars are honking and you're out on that main level, and although it's exciting, it's also extremely noisy. And now what I want you to think of is that's kind of like your perception of maybe the city. And then as you go up, if you go up the escalator and you kind of rise up, and then you go up to the very top floor, and then you maybe take a peek over the city from a satellite view, all of a sudden it's a lot quieter. And it's a lot different, and your view of the city is very different on the 8th or 9th or 10th floor of a hotel. And so I want you to think of that. That's what we're going to be doing with your body and symptom, is you're down on the ground level right now, and it's noisy, and it can be stressful, and it can be concerning, and you just want a little bit of reprieve from it. And so what we're going to do is we're going to take your mind. I'm going to show you how to take your mind up a whole bunch of floors so that you have more of a satellite view, and we've expanded the mind so it can have a bigger view. And when you're up there with a bigger view, guess what? You can breathe easier, you can kind of open up, you could almost be like, holy cow, what a view, what a scene. And so that's what we're going to take your mind on. So just stay with us. I'm going to show you exactly how the exercise that I bring through patients, and look forward to delivering this to you. Okay, so at the board here, let's just take like a shoulder, for example. And what I have people do is they're just relaxing and laying down, and I say, okay, what I want you to do first is I want you to draw a line in your mind, so their eyes are closed, and I want you to draw a line around and feel around where the symptom is. So I'll have them just kind of like show me, okay, this is kind of right around this area here, or if it's on their spine, it'll be like around this area here, and we'll just mark it out as to the kind of the north and south, east and west areas of the pain, and we kind of mark that out that way. And so that's where the mind is essentially located too. And what I have them do is I also ask them, if this area was a color, what color would it be? And then they'll give a color. And so you might notice, hey, maybe it's green, or it's blue, or it's black, or it's red, or something like that. Like you'll intuitively have a color that can be brought to that area. And so now that they have a color and we have it marked out, now what we do is we begin to expand the mind. So what I ask them to do is I say, okay, I want you to envision first, this is like a solid brick wall. And what I want you to do is I want you to first turn that solid brick wall, and I want you to relax your mind so that it just becomes kind of a loose rubber band. Okay, so now it's a loose rubber band. Okay, now what I want you to do is I want you to take the top edge of this rubber band, and I want you to bring it over your head like this. So that you envision this upper end of the rubber band pulling up to the top of your head. And then what I want you to do is I want you to take kind of this east side of the rubber band, and I want you to stretch that out so that it starts to stretch to the right of the body and over the foot. There. So now we have kind of that north end of the rubber band pulled up over the head. We have this right side or east side pulled and stretched out to the bottom foot and beyond your body, just right at the edge of the body. Then I'll say, okay, take this bottom part of the rubber band, and we're going to stretch that, and that's going to stretch right to the bottom. So now we've stretched this part. And then this last part of the rubber band, so now this, I guess you can say this is kind of gone in the mind. Then for this last part on the west side, we're going to bring this and we're going to stretch the rest of the rubber band out along this left side of the body. So now what they have is, instead of that circle encased with their symptom, they have stretched the mind so that this rubber band has encircled their whole body. And so then I say, what I want you to make sure that you're doing in here is filling and coloring all this in with the color that you decided the symptom was. So if it was red or blue or green, you're stretching that out. And so now your rubber band is encased around your whole body with that whole color that you chose right at the outset. Now, the mind is now expanding beyond the symptom, and it actually encompasses the whole system. Now what I have them do, now that this is surrounding them, is I begin to stretch a little further. So now I ask them, I said, okay, stretch this rubber band. I want you to stretch this rubber band another 3 feet outside your body. So now stretch it and keep the same color. So now you are completely consumed with this color and the rubber band all around. Like that. Now 3 feet outside your body. So now their mind, they're focusing, they're present with stretching, everything's stretching around them. The color, everything's colored. Let's just hypothetically say it's red. So now the whole body, the whole surrounding is all red. Now what I'll have them do is I say, okay, can you see that? Yes, I got it. Okay, great. Now what I want you to do next is I want you to begin the process of coloring this in, and color this in white. So now in your mind, I want you to almost take like a paintbrush, and I want you to start to paint it all white on the inside, from top to bottom, all on the inside of the rubber band, so that the whole inside is completely white. Now that might take a little bit, because there's going to be little pieces of the mind that don't want to actually brush, and there's going to be hesitation, and there's going to be this little piece of the mind that it's like, no, I don't want to color this part, and it's a really funny game in there. But we want essentially it all colored in white. Now what I have them do is I say, okay, what I need you to do now is, you see how it's all white, you got this big rubber band stretched all the way around you. Okay, now what I want you to do is take a pair of scissors, and I want you to cut the rubber band so that it disappears and flies off. And then I want you to take this white, and I want you now to start to stretch it. Now that the rubber band's gone, just stretch it and start like a cloud, start to push that out to the environment. 10 feet, 20 feet out from you. And so now the mind being present is really stretching itself, and its vision of what's going on inside. And then, once that's complete, and they're in an extremely relaxed, present, and mind-expanding state, we then have them just move their body and observe to see what they feel. And more often than not, the symptom, if not it's changed, it's completely gone in that moment. So it's an extremely powerful exercise, and you can revisit it, you can come back to it, you may find the nature changes, the location changes, and things of that nature, but this is something that you can do on a semi-regular basis, because what you're doing is you're creating a couple of things. Extreme amounts of presence. That's what you're creating. You're creating a situation where you're pulling your energy out of your stress and anxiety center and you're putting it into the cortex of the brain, healthier area of the nervous system, to open the mind and to balance out the physiological state and your tensions. So it's putting you in an extreme presence. The second thing it's doing is actually stretching the mind and beginning to build a new relationship with the body. And you're just going to feel different in that expanded state. So it does a couple of those things. And thirdly, in fact, it actually starts to get your heart center on board, which is why we bring the white in as a white, big, bright white light. And we're stretching that out. So there's a whole kind of energy dynamics that seems to be working with this. The expanded mind and a more balanced, relaxed body, and you being more present. So there's a whole bunch of benefits from a health standpoint that come with this exercise. So I would love for you to do that exercise. Follow along if you have to watch, and comment below to see like if you're noticing some changes in symptoms or your body. And of course, this doesn't replace any medical advice, and this doesn't replace any doctor visits that you might require. This is purely for some educational, inspirational advice for you that I've personally done in my practice as a practitioner after I've done my clinical assessment, etc. But this is something that you can apply in your life and just see how it does. And at the same time, again, it's like a meditation. So this should take you anywhere between maybe 5 to 10 to 15 minutes to do properly. That coloring in piece takes a bit longer, but anywhere between 5 to 15 minutes, this exercise can be really life-changing. So I encourage you to do that and let us know how this exercise works for you. Be curious. Thanks so much, and we'll see you on the next video. Hey guys, Dr. Steve here. If you hate this channel, leave a nasty comment below and don't subscribe. But if you do like this content, I'd love for you to be able to hit that subscribe button, hit the like button, and leave a wonderful, inspiring comment below as to what you're learning. So we'll talk to you soon.